So as I mentioned, there's a second type of tape job that we can do to help a patient with medial tibial stress syndrome. This is probably my preferred method, most certainly, especially when you have a patient who has large gastrocs and you just can't manage to avoid wrapping around the gastrocs. So what I'm going to do is what I did with the first shin splint tape job is place that tape just underneath the calcaneus, and then there will be a few drastic differences. What I'm going to do is create basically a stirrup on the lateral side of the leg as an anchor point, and then I'm going to place that same stirrup on the medial side of the leg. And the length of the stirrup will be dependent on how much pain and the length of the pain of the tibia. So in my guesstimation, this patient is having pain from here to here, hence the reason my stirrups are this long. But if they were having pain from here to here, right, then we would certainly lengthen those stirrups to accommodate the length of their pain. So again, just like we talked about with the other shin splint tape job, what we want to do is essentially pull, okay? So in this case, I'm going to start distally, and I'm going to pull it medially and anchor off. And then I'm going to do the opposite. I'm going to start distally medially and pull laterally and use that anchor. And I'm going to work my way all the way up, half strip by half strip. Once you finish this tape job, unfortunately, they cannot go to participation with just this, because what we know is that once they sweat, the entire tape job will peel off. So what we're going to do is use our stretchy tape to ensure that the tape job stays put. And these are two different ways that you can tape and reduce the amount of pain the patient has if they present to you with medial tibial stress syndrome. I would like to give this one caution to make sure you've ruled out a tibial stress fracture before returning the patient to play.